Hi, from this video onwards we will be starting with the periodontic dental anatomy. The first video will discuss about the features of primary maxillary central incisor in detail. Watch the video till the end to understand it well. We at DentoRise welcome you all to a platform where we help you to conceptualize, visualize and memorize dentistry. As discussed in our video on tooth numbering systems, the right primary maxillary central incisor will be named as 5-1 and the left primary maxillary central incisor will be named as 6-1. The dental anatomy of primary maxillary central incisor will be discussed under 4 headings. The labial aspect, the lingual aspect, the mesial and the distal aspects will be covered under one heading, that is the proximal aspect, and the incisal aspect. Starting with the labial aspect, first of all, coming to the dimensions, the length of the crown cervicoincisally is 6 mm, length of the root is 10 mm, the mesodistal dimension of the crown is 6.5 mm, the mesodistal dimension of the crown at cervix is 4.5 mm. Now if we compare these dimensions with the dimensions of permanent maxillary central incisor, then there are two main differences. The first difference is that within the primary maxillary crown, first of all, if we compare the mesodistal diameter of the crown and the length of the crown, then the crown of primary maxillary central incisor is more wide and less long. You can observe in the figure and you can observe in the dimensions also. If we look in a permanent maxillary crown of central incisor, then the mesodistal diameter is less as compared to that of the length of the crown. That means the permanent maxillary crown in a central incisor is more long and less wide. The second difference lies in the length of the root. In a primary maxillary central incisor, the length of the root is significantly greater than that of the length of the crown. That is, there is a difference of roughly 4 mm between the length of the root and length of the crown. However, in a permanent maxillary central incisor, the root length is greater than that of the crown, but the difference is not very much. That means there is just a difference of 2 to 3 mm between the crown length and the root length being more than the crown length. You can observe in the figure very well. The other features of primary maxillary central incisor are the labial surface of this tooth is very smooth, developmental lines are not usually seen, the incisal edge is nearly straight, the incisal edge joins the mesial surface at an acute angle and the distal surface at a more obtuse angle, the root overall is cone shaped with even and tapered sides and has a flat surface. Coming to the lingual aspect now, the lingual aspect of primary maxillary central incisor has a very well developed mesial marginal ridge, very well developed distal marginal ridge, even the cingulum is very highly developed and there is a concavity in between. These features are similar to that of the permanent maxillary central incisor lingual aspect. However, the difference is that the cingulum in this tooth is so highly developed that it extends down till the incisal surface, partially dividing the concavity into two fossas kind of thing. These fossas can be named as mesial and the distal fossa. The next thing, if a cross section is made at the junction of the crown and the root from the lingual aspect, then this cross section is roughly triangular in outline with labial surface making one side of the triangle and the mesial and the distal surface making another two sides of the triangle. If we talk about the root narrows down lingually and it presents a ridge for the entire full length, unlike the labial surface of this root which was absolutely flat. The next aspects under this tooth are the mesial and the distal aspects. Since they are nearly very similar with just one or two differences, we will be discussing both these aspects under one heading, that is the proximal aspect. Coming to the dimensions, first of all, the labiolingual diameter of the crown is 5 mm. The labiolingual diameter of the crown at the cervix is 4 mm. If we compare the labiolingual diameter of the crown with that of the length of the crown, then the labiolingual diameter of the crown is just 1 mm short than that of the length of the crown, indicating that the crown is wide in relation to its total length. It is because of this only the crown appears to be thick at the middle third and even at the incisal third. Talking about the curvature of cervical line, which represents the cemento-enamel junction, the curvature of cervical line is towards the incisal ridge. This curvature is more on the mesial aspect of primary maxillary central incisor than that of the distal aspect. If we talk about the root from the proximal aspects, then the root is blunt than that of the labial and the lingual aspect. It has an even taper. The shape is that of a long cone. Developmental groove or concavity is present on the mesial surface of the root. However, it is absent on the distal surface of the root. So this is second difference between the mesial and the distal aspect of this tooth. The root apex is blunt. Coming to the last aspect, that is the incisal aspect of primary maxillary central incisor. The major important feature to note from this aspect, first of all, is the measurement mesodistally as compared to that of labiolingually. To recall again, the mesodistal diameter of the crown is 6.5 mm and the labiolingual diameter of the crown is 5 mm. That means the crown is wider mesodistally. Overall, from the incisal aspect, we can see a labial surface which is much broader and also smoother than that of the lingual surface. The incisal edge is centered over the main bulk of the crown and is relatively straight. The lingual surface tapers towards the cingulum. The mesial and the distal surfaces of this tooth are relatively broad to make good contact areas with the adjoining teeth. However, it is for a very short period of time. So this was all about the dental anatomy of primary maxillary central incisor. The link for the dental anatomy of permanent maxillary central incisor and all of the dental anatomy videos have been given in the description box below. Hope the video was helpful for you. If you like our content, please do not forget to like, share and subscribe to our channel. Hit the bell icon so that you can get notified whenever we upload any new video. Suggestions are always welcome from your side. Stay tuned, stay safe. Thank you for watching.